Yeah, the video, it's okay.
All the videos are fine,
okay.
and you have the list, and Anna's with you in case. Perfect. Thank you so much. Hi, Ariel. Welcome.
How are you?
Good to see you.
I'm trying to get your background photo, but here it is.
Okay, let us know if you have issues. We can send you. Yes, we can send you details. Yeah.
I'm trying.
Thank you.
But it's not.
Hi, Vavan. Can you hear us? Satyavan?
Yes, Monica. Just let you know that our Minister of Health will be the panelist from Indonesia. I had shared the link shared by the committee to him. So
Thank you, Vavan. We've promoted you to panelist, so please, could you let us know as soon as he's here? We very much welcome the participation of the Honorable Minister. So as soon as he is connected, we will do a quick test. Thank you.
yes, he will join with the panelist link shared by the system yesterday.
Thank you very much. Thanks. Hi, Bharti. How are you? Can you hear us?
Yeah, I'm good. Thank you so much.
Can you please turn on your video so we can see you? Oh, wonderful. You're looking lovely. Thank you so much for connecting. So can you hear us clearly? Can you say a few words?
Yeah, I can hear you. You're very much audible. But for myself also, I would like to know, am I very clear and sound loud?
Okay, perfect. Thank you so much, Bharti. We can hear you clearly, and you've changed the Zoom background to the one of the events, so that's brilliant. Thank you so much for connecting. Yeah, and thank you. And many thanks to our attendees who are also connected here today. Thank you for joining in advance. It shows the enthusiasm for the event, but we ask for your patience. We will commence the event in exactly 19 minutes, and we request your patience as we test for lighting and sound so that we have a high quality event. Thank you.
I'm glad you're having lunch with you.
Hi, Monica.
Hi, Pak Imran. Good to see you. Thank you for your support as always.
Yeah.
Hi, Kathy. Good to good to see you here. Just doing a very quick check to see your video. Can you hear me? Kathy Hevison from MSF. Can you hear me?
Yes. Hi, Monica. How are you?
Hi, Kathy. Really good to see you.
Thanks for being happy to be here and support this. Really important.
Thank you so much. So, quick check of you look clear and sound is good.
Okay. Great. Speak to you later.
Hi, Luchika. How are you?
Hi, I'm fine. How are you? Let me put my face here, but I will stay somewhere else. I'm just here for a second. So should I put good afternoon, everyone? Should I put my background? Hey, Hari, how are you? Should I put the background?
Yes, Luchika, if you could put the background, that would be great.
I am doing that now.
Brilliant. And we can see you and hear you clearly. Thank you so much.
Thank you. All set. Here I am.
Brilliant. Thank
I
you.
look like a potato, but that's okay. You see? You see?
No, you
This
look lovely as always. Okay, and Harry, very quickly turning to you. I see you're connected as well, which is good.
Yes. How are you?
Good, good, thanks. Okay, so you're clear as well.
And I can
And
see some
lighting and sound is good. Thank you.
Good. I will, Monica, just for the idiots of the group here, I will mute myself and and take my face off, till 3 o'clock. Is that okay?
That's absolutely fine, Ruchika. Thank you so much.
But I'm here, so I will just appear when you will call on this. Okay, good. Thank you.
Brilliant. Thank you, Luchika. Okay, now turning to Dr. Sam Cooney. I see you're connected. It would be great if you could put your video on just so we can check. Dr. Cooney?
Yes, I am. Okay. Hi, how are you? Oh, I have to.
Good, thank you. How are you?
Yeah, I would say, make a kind of a background into that one. Maybe later. Yeah.
Maybe later. Up to you. We can see you. The sound is good.
With a lot of meetings. Sorry.
Okay, great. Thank you so much.
Sorry, can you see my background properly?
It's wonderful. It looks great. Thank you so much.
Thank you.
Dear colleagues, we will be beginning in just 2 minutes. Thank you for your patience, and it's good to see nearly 200 people already connected online. We will do just 1 more minute of testing, and then we will go live. So if the panelists could kindly turn on their videos, that would be appreciated. We already have Dr. Tedros with us, so we will begin very, very shortly. Thanks, Jennifer. I see you. Okay, I see you and Ivy together. Thank you. Thank you for joining, Sergio. And Teeb, I see you as well. Thank you, Pak Imran. Harry, Bharati, Kathy. Excellencies, honorable ministers, distinguished delegates, dear colleagues and friends. I am Dr. Teresa Kasaeva, Director of the World Health Organization's Global Tuberculosis Program. I am very pleased to welcome you to this important high-level event where we will shine the spotlight on the importance of TB prevention, which urgently needs to be ramped up to reduce suffering and save lives from tuberculosis, one of the world's top infectious killers. I am very pleased to introduce my co-chair and friend, Dr. Ariel Pablos Mendes. He is the chair of WHO Strategic and Technical Advisory Group on TB.
Thank you all for joining us, particularly this important call to action. Treatment and prevention efforts have turned the tide against HIV/AIDS and is essential fight against tuberculosis. While treating tuberculosis also prevents tuberculosis itself, we are missing a third of the cases after historical expansions in the treatment efforts around the world. Tackle TB from the other end as well, in order to achieve goals and more urgently the goals for the UN high-level meeting in the next 18 months. So I think that although we have much to build from today, including shorter preventive treatments, we need to do much more and address systemic bottlenecks like the supply of PPE, updates and training of health providers, and technological breakthroughs to scale up prevention safely and efficiently. I thank Teresa and WHO for taking the lead in this in the last few years after decades of neglecting this area, and as we now lay down for all of us in this call to action. Thank you all.
Thank you very much, Ariel. We have a very distinguished lineup of speakers and panelists, and I'm honored to welcome WHO Director General Dr. Tedros Adhanom Ghebreyesus, Dr. Renmin Gui, Assistant Director General, and other senior WHO leadership, health ministers, and high-level government representatives, as well as heads of agencies, TB survivors, civil society, and partners. Thanks to our audience, we had over 1,000 registrants. It's really impressive. This event is being live streamed not only on Zoom, but also on YouTube and our interactive virtual platform and TB forum. This event will be translated into all WHO official languages plus Portuguese. We have a very rich and busy agenda today, and we look forward to discussing key actions needed at global and the country level to scale up TB prevention strategies and drive progress towards achieving the 2022 UN high-level meeting targets on TB preventive treatment. To open this high-level event, I'm very honored to welcome Dr. Tedros, our Director General. We appreciate, Dr. Tedros, your commitments to the fight against TB and your unwavering support. Thank you for making time to join us. We would appreciate your opening the high-level event with your keynote address.
Thank you, Teresa, and thank you, Ariel. Thank you, my friend. Excellencies, honorable ministers, distinguished delegates, dear colleagues and friends. Good morning, good afternoon, and good evening, and thank you for joining us from wherever you are in the world. Tuberculosis remains one of the leading infectious killers globally and the leading cause of death among people living with HIV. Despite being a preventable, treatable, and curable disease, TB kills more than 1.4 million people each year and affects millions more with enormous impacts on families and communities. Ending this debilitating disease remains a priority for WHO, and in recent years, we have made encouraging progress globally. More than 20 million people received access to TB services over the past 2 years. Almost 5 million more than the previous 2 years. 109 countries have started using new effective TB drugs, while 89 countries reported using better and faster treatments for multi-drug resistant TB in line with updated WHO treatment guidelines. But the COVID-19 pandemic has put these gains at risk. Not only does the virus pose an increased risk to people with TB, it has also caused severe disruption to services. An estimated 1.4 million fewer people received care for TB last year, 21% less than in 2019. This disruption could cause an additional 500,000 deaths. While vaccines are now giving the world hope of ending the COVID-19 pandemic, we don't have an effective vaccine for TB. But we do have tools to prevent people at high risk of TB from developing disease. This includes preventive treatment, which reduces the risk of disease by up to 90% and can provide years of protection against both TB and the risk of premature death for people with HIV. It can also prevent hospital visits and protect families and communities against catastrophic costs. But globally, we're not using this tool as effectively as we could. Although the number of people receiving this life-saving intervention has quadrupled since 2015, it's not enough. In 2018, member states at the UN high-level meeting on tuberculosis made bold commitments to provide TB preventive treatment to at least 30 million people by 2022. This included 24 million contacts of people with TB and 6 million people living with HIV. While we are on track to meet the target of people living with HIV, we're falling far short in reaching contacts of people with TB. By 2020, less than 10% of the target was reached. If we are to achieve the UN high-level meeting targets for TB preventive treatment in the 18 months left, we need to act with urgency. This will require providing TB preventive treatment to at least 3 contacts on average for every TB patient detected. To achieve this, we need 3 things. First, we need to scale up preventive treatment for household contacts of people with TB, including children, alongside efforts to find people with TB disease among people living with HIV. We must pay special attention to settings with high prevalence of undetected TB, such as informal settlements and prisons. Second, we call on ministers of health to scale up access to primary health care and community-based services to reach the household of every TB patient. This will also require investments in WHO-recommended technologies to screen, test, and provide care for affected households. And third, all stakeholders need to work together to build the capacity of health workers and health systems on the use of TB preventive treatment and to overcome hesitancy. We have a lot of work to do, but it can be done. We have shown that by reaching our treatment coverage target of 6 million people living with HIV well ahead of 2022. Success such as this must strengthen our resolve to reach all contacts and other populations in need of TB preventive treatment. New technologies like digital radiography, computer-aided detection, and molecular diagnostics offer the opportunity to do better for less. As we sprint towards the 2022 targets set by the UN high-level meeting, I want to remind you that the struggle to end TB is not just a struggle against a single disease. It's also the struggle to end poverty, inequity, unsafe housing, discrimination, and stigma, and to extend social protection and universal health coverage. If the pandemic has taught us anything, it's that health is a human right, not a luxury for those who can afford it. With solidarity, determination, and the equitable use of tools, we will defeat COVID-19. And with the same solidarity, determination, and equitable use of tools, we can end TB. I thank you. And Teresa, back to you.
Dr. Tedros, thank you very much for your inspiring words and opening this high-level event. We appreciate your leadership and support. And now I would like to invite another very important speaker, Dr. Bharati Kaloti, a TB survivor and passionate advocate. Affected with TB and drug-resistant TB twice in her lifetime, she has risen to champion the fight against TB. She will share with us today her experience and vision on getting access to TB preventive treatment on time, on how vital this is, especially in these times of crisis. You're welcome, Dr. Bharati Kaloti.
Honorable ministers, heads of government delegations, respected donors, national TB program managers, technical partners, and community members. A very good day to you all. My name is Bharti, and I'm speaking to you today both as a doctor and as a TB survivor. I want to convey to you the sufferings of millions of TB patients everywhere in this world all the times, and would like to share my story with you all. I endured TB twice in my lifetime. First, when I was a medical student at the age of 24 years, and second, as a medical professional, when I was working as a member of the national TB program of my country. My first episode was TB in lymph node. It could have got treated easily in a month of 6 to 9 months of treatment, but it dragged to 3 years. There was change in medications, injectables, and finally I landed in a very major chest surgery. At that age of 24 years, this was very painful for me, both at mental and physical level. And it brought lots and lots of devastating experiences for me. I had the veins blocked in both my arms. I had to take injectables through my feet and my legs. I developed cataract in both my eyes, for which I had to again undergo a surgery after 2 years to regain my vision. And I had recurrent abortions because I was not strong enough to carry my pregnancies to the term. I don't have words to explain my pain. There is a 10-inch long surgical scar, which every day reminds me of my sufferings I've gone through in those years. But I was young and I fought it strong. After 20 years, one day in the morning, I rise up, look myself in the mirror, and I see a round swelling under my left jaw. It was worrying. I could guess what's coming up. After going through all the barrage of tests, microscopy, molecular test, culture, biopsy, I was given the diagnosis. It was TB again. But to my horror this time, this TB was resistant to all the first-line drugs and some major second-line drugs. I was left with no choice but a minimal choice to have those toxic medications. I was given injection imipenem twice daily, morning, evening, intravenous drip, tablet clofazimine turned my skin dark. 16 pills in a day was what I was taking for 2 long years. And every drug had its own unique side effect, which really took a toll on me. This experience actually showed me what sufferings of TB really mean. At the end of treatment, I had gained almost 16 kgs of weight. I had a purple discoloration of my skin because of the toxicity of drugs. And I felt as if I have aged prematurely. I was living like a woman aged 85 years because I had severe joint pains. I could not walk. I wanted somebody to support me to go out, to climb the stairs, and I would not move out alone. All these sufferings which I have gone through, I look at them as my badges of the battle with TB. But I keep wondering, what would my life have been had I have been given preventive therapy 20 years ago? I could have been saved from this. And it was even more important that if I missed the preventive part of my therapy, at least a person in my line of work who was closely working with the TB patients should have been regularly screened for TB. I did not get that opportunity also. I was never screened for TB. Had I got that benefit, I assume that my TB would have diagnosed early. I would have got a rapid diagnosis. And it could have prevented the disease from digging that deep into my body. I could have been spared from my misfortune brush with MDR TB. And I'm not speaking this as a doctor today. I'm speaking this on behalf of those who have seen the same sufferings. Today also, our governments, TB communities, grapple to get the best diagnosis and drugs for themselves and for the millions who need like me. My question is, how long is this going to last? Do we really have a solution to this? This could not have benefited me only as a professional or any other professional like me. There are also those who are at risk. The contacts of TB families, TB patients, their contacts of all ages, people living with HIV,
Personnes de tous âges
living in overcrowded,
vivant auprès des personnes
like in my country.
tuberculeuses.
It is said that when a person gets TB or MDR TB, and I say this from my experience, you fall prey to the same anguish any human being would who wants to survive and who wants to protect their near and dear ones from the same fate. We say sufferings make us stronger. But for us, people like me who have survived, this strength came at a major cost. I urge all the dignitaries and partners at this event today to please keep the human side of TB constantly in your mind. For me, the main message today for this event rolls down to this. Prevent TB and take bold actions to roll back this disease. Patient with TB needs support. He needs counseling. for himself, his family. He needs rapid diagnosis, convenient diagnosis, non-toxic drugs, and a short regimen, a short treatment. The treatment may be to prevent TB or it may be to cure TB, but it has to be short. And it is very much feasible in the low resource settings today. Let's also not forget to think that the impact of COVID-19, how it has hampered the TB services, and how do we need to get to those people who actually require these services when we have such scenarios. We can do this. We can do this with the support of the public sector. But let's not also forget the private sector, which caters to a huge number of TB patients, manages a big number of TB patients, especially in countries like India. We should know how to educate these providers, educate the families, educate the communities, and let them know what has to come first at the right place. It's time to join hands and resolve to cut this suffering. I'm encouraged to see the concerted effort of WHO and global partners to call upon the governments and donors for setting targets and setting actions to meet the UN target by 2022. It is my humble plea to all the distinguished delegates. Please head this call and play your role now. Thank you for all your engagement. On behalf of all the TB patients, survivors, and the doctors, I look forward to a very fruitful outcome of the deliberations today and wish you all good luck and good day. Thank you.
Thank you very much, Dr. Harati, for your very important messages, for your courage, for your openness, and for your dedicated, passionate advocacy. We need this knowledge, we need your support, and we need more voices like you to promote this understanding of importance of TB prevention. I would like now to give a brief introduction of the sessions and set the scene for our high-level event today. We will have two main sessions at this event. The first session will focus on country leadership with a high-level ministerial panel. And we are very pleased to have high-level participation with the ministers of health joining us today. This session will be followed by the launch of the call to action and perspectives from the TB community. And the second session will be a roundtable with the heads of agencies and partners, followed by an interactive open forum. Let us now start with the high-level ministerial panel, and we are very honored and pleased to have statements from the health ministers of India, Indonesia, Russian Federation, Nigeria, Philippines, Brazil, and Pakistan. To truly speed up momentum on TB prevention, we need high-level leadership commitments and investments. Let us hear from the honorable ministers about the progress they've made in stepping up TB prevention efforts in the face of COVID-19 pandemic and their vision to reach targets over the next 18 months. I would like to start with His Excellency Honorable Health Minister of India, Dr. Vardhan. And first of all, we must acknowledge and applaud to your efforts. While India carries the highest burden of TB, significant efforts and innovations have been taken forward on TB prevention and care. There is a commitment at the highest level to take this agenda forward with the Prime Minister Modi. we are inspired to have you with us, Honorable Minister, today. And I am looking for the confirmation that Minister is here with us and ready to share his thoughts and speech. Dear colleagues, we are waiting for a few more minutes. Honorable Minister is on his way, and we appreciate his time. It's a very busy time for India, as you know, and it's important to see still that TB is not neglected, that it's prioritized at the highest level. And we see that Honorable Minister is joining us, and please, Your Excellency, floor is yours.
WHO Director General Dr. Tedros, Excellencies, Health Ministers from across the world, representatives from other high TB burden countries, affected persons and civil society, development partners, donor agencies, ladies and gentlemen, Namaste. I extend my deep gratitude to the WHO and the various countries and partner organizations who have extended their magnanimous support to India and helped us tide over the vicious second wave of the COVID-19 pandemic, as well as the two very severe cyclones which affected many parts of the country in quick succession this year. As a member of the global family, India too reaffirms commitment to continue contributing to global efforts at combating COVID-19, while simultaneously ensuring that India's tuberculosis elimination program adapts rapidly to the situation with innovative mitigation measures. In the last 1 year, despite the COVID crisis, we have amplified measures like bi-directional screening, clubbing active TB case finding with COVID-19 surveillance, and doorstep TB services with greater agility and resilience to rapidly gain lost ground and continue providing unimpeded services to TB patients. Under the able leadership of our Prime Minister Shri Narendra Modi ji, India has demonstrated unprecedented political commitment to end tuberculosis by 2025, 5 years ahead of the SDG target of 2030. Expanding access to accurate TB screening and diagnostic tools like NAT and digital X-ray with artificial intelligence aided detection, high quality drugs, digital technology, multi-sectoral community engagement, integrating TB services across all levels of our health system are all aligned to rapidly push down the TB incidence and mortality curve in the country. We have also initiated sub-national certification of states and districts in 2020 on progress towards TB-free status, under different categories measured with graded milestones of decline in TB incidence. I am proud to announce in this forum that the Union Territory of Lakshadweep and the district of Budgam in Jammu and Kashmir have been certified as the first TB-free Union Territory and first TB-free district in the country in 2020. Friends, we truly believe that this is just the beginning, with more states and districts expected to stake their claims for TB-free status in the coming months. However, to end TB, we also need to explore fresh and innovative approaches. We need to accelerate development of new diagnostics, vaccines, and drugs. These are critical for achieving the SDG goal for TB. The COVID-19 pandemic has shown us that if the world unites, it is possible to develop vaccines in less than a year. We need a similar approach for TB. We need to aggressively advance technology development, focus on building and strengthening scientific capabilities and implementation strategies. While the world eagerly waits for new TB vaccines, TB prevention using available, effective, and safe tools needs to be expanded and sustained to turn off the tap of emerging new TB infections. This is the only way to witness an accelerated decline in TB incidence and mortality. Scaling up TB preventive treatment will be a game changer in TB elimination efforts. Learning from the COVID experience, we are implementing the TB program based on a 5T strategy. That is testing, tracking, tracing, treatment, and technology. I am confident that by accelerating contact tracing, screening, simultaneous testing, and treating for those detected with TB infection or TB disease, coupled with smart use of technology, we will be able to reach out to the missing TB cases and also protect all family members and high-risk groups. With aggressive implementation of our fully funded National Strategic Plan to End TB, we stand committed to rapidly achieving national scale-up of TB preventive treatment and activities to achieve the UN high-level meeting target of 40 million persons started on TB treatment and 30 million on TPT globally in the remaining 18 months. For this, India is moving ahead with increased domestic budgetary allocations, complemented by the support of partners like WHO, Global Fund, USAID, BMGF, and many others to scale up newer diagnostics and drugs for containing TB infection. Our national TB elimination program has done phenomenal work in the last few years and is arguably the biggest project in the world. More than 50 million people have been treated under this program, which is not a small figure. But our issue is that we have 1.3 billion people and a number of social, economic, and political factors which come into play. We have a vast population living in rural areas. We are now trying to integrate the private sector very effectively with the government sector. Through a program of strategized advocacy, securing societal and political commitment, thought leadership, disruptive social entrepreneurship, minutely monitoring the progress of the government program, and reaching powerful public action campaigns to the remotest tribal districts, India is actually firing the imagination of her people to drive a mass movement to win this war against TB. I thank the WHO Global Tuberculosis Program for organizing this virtual high-level event and to reaffirm our collective call to action 2.0 to scale up TB prevention. I congratulate all of you who have come together today to discuss TB prevention. I call upon the global community to multiply our collective resolve and efforts to ensure adequate funding so that we can scale up TB preventive treatment by 2022. The goal is to have a TB vaccine by 2023 and TB in India by 2025 and end TB globally by 2030. I wish all of you a very successful dialogue.
Thank you very much, Your Excellency, Minister Vardhan, for your strong commitments followed by very concrete actions and important actions. The whole world is looking at India and inspired by your examples, and you shows by your concrete examples that ending TB is possible and even elimination TB. Thank you very much once again. And now I'm pleased to invite another champion, His Excellency Honorable Budi Gunadi Sadikin, Minister of Health, Indonesia. Indonesia is one of the pathfinding countries that has made progress in scaling up access to TB prevention and care services, including through engagement of other sectors and through the use of innovations. The leadership of President Joko Widodo of Indonesia has been key with this agenda to accelerate the elimination of tuberculosis and COVID-19 in conjunction. Investments in TB have also significantly increased. Honorable Ministers, we look forward to hearing from you.
Thank you. Dr. Tedros, Excellencies, Health Ministers, distinguished delegates, ladies and gentlemen. Thank you for inviting me to this event. In the 2018 United Nations General Assembly high-level meeting on the fight against TB, Indonesia and other global health leaders have affirmed that the time for TB is up. TB no longer has a place in the history of mankind. Unfortunately, this COVID-19 pandemic is disrupting TB control programs. Indonesia, as the second largest TB incident globally, has experienced so. Movement of people has been limited, preventing people from seeking treatment and health workers from delivering TB services. But we are all committed to ending TB, improving case detections, expanding access and provision to TB preventive treatment, and further strengthening multi-sectoral approach for TB control and prevention. We also need to see the pandemic actually as a window of opportunity to innovate. Indonesia embodies the commitment through, first, the development of the Presidential Decree on Tuberculosis Prevention and Control to pursue and accelerate a more concerted multi-stakeholder effort, because health only